Hi, my name is Dr. Linda Clark, and I serve as the Chief Medical Officer at Common Ground Health. I want to talk to you a little bit about why community partnerships are so important. I want to use the example of COVID-19 because if you're like everybody else, you're getting tired of COVID-19 and the community is running on fumes. We're almost out of gas. We're tired. So how does COVID-19 serve as an example of community collaboration? Well, one of the things that happened early on were lots of myths. I heard everything from Black people can't get this disease to drinking bleach will kill it to, oh, it's no worse than the flu, or, there's a chip in the vaccine. They're going to try to track you if you take that vaccine. And oh, don't do that. The vaccine will give you COVID. So myths were running, they're abounding and they still are. And I think it's important, just like with your car, that you got to pay attention to the signs that something's wrong. Your check engine light is on. And when your check engine light is on, you have to do some research to find out why. So what was the community and the providers' initial response to COVID? If you can recall those days where you saw pictures of nurses and physicians working tirelessly, putting people on ventilators and being stressed because there wasn't enough hospital beds, you know that the community and the providers were running on fumes. They were exhausted. And exhaustion leads to moral injury. It leads to constantly being on high alert. And all of this feeds into this problem of running out of gas. And the community was at the same level. So when drivers are fatigued, what do? You need to pull over. You need to make sure that you take care of your vehicle. Now, one thing that we did find, like a car analogy that we're going to continue with, is that certain communities really seemed disproportionately out of gas. You hear the term, you're sick and tired of being sick and tired. Well, that's what was going on in the Black and Latino community because they suffered disproportionately from the impact of COVID. And we know that this is because of existing inequities. It was just magnified when COVID came along. So one thing that we saw were that Black and Latino people were getting the disease at a higher rate. We saw that they were hospitalized more often and that they were more likely to die. As a matter of fact, Blacks were 4 times as likely as whites to be hospitalized for COVID-19. When you talked about the death rate for COVID, Blacks and Latinos were twice as likely as whites to die from COVID-19. So these communities were disproportionately stressed. And at that time, it was very clear that we needed to check under the hood. We needed to see what are the roots of the problems? How can we together work to make these communities more prioritized to get a better chance at health than they were clearly getting during this pandemic. So we formed an organization called Community Fighting COVID. And this came together originally out of the University of Rochester. I was asked to speak there about the issues of using SOFA scores, which were a set of criteria used to determine who would get high need equipment. So in this case, ventilator allocation. And if you had certain SOFA scores, you may be more likely to get a ventilator as opposed to other ones. And it seems to disproportionately impact the minority community. And I told them, I'm like, my specialty is preventive medicine. What can we do to prevent people from getting on the ventilator or in need of a ventilator? So we started Community Fighting COVID, the Black Physician Network, and the Rochester Black Nurses Association. We started to get together and think of how could we educate our community? What kind of tools can we provide to help the community be prepared to fight COVID? So with partners, We found that we were able to get much needed things like equipment, educational materials, and we were able to go out into the street to offer free screenings. So how do you do that? You got to make connections. You have to understand who the resources are in the community. And we were so pleased, early on, Common Ground Health came in, helped us develop materials, connected us to masks. Some of the people there made masks. We had Rochester Regional Health, we had the University of Rochester, we had the Rapid Response Team, the City of Rochester, all coming together, Jordan Health, Ibero, all coming together to provide this response to the community. And what we found is that being connected gave us a jump start. Similar to a car, when you jump that car, you can get going again. So what are some of the other ways that we connected to the community to make sure that they started to get that energy again, that they got what they needed to be healthy and whole? Well, one of the things we did was a program called Mythbusters, where we took some of those myths that we were talking about earlier and had fun with them and educated the community at the same time. We had a mass canvassing project not too long ago to make sure that people who typically were the last to be served would be the first to be served by getting access to vaccine. Which is life-saving for our community. And we had our neighbors walking door to door, just making sure that people had the information they needed to have access to that much needed resource. So we're starting to meet the community's needs. We feel that we can rev the engine. We can, start to get people motivated and moving again. We're out in the communities. We're talking directly with people who need it the most. But we're not doing it alone. In one case, we have RTS giving people a warm place to sit and get registered so that we can do COVID tests, have a bus where we could provide education. And what we've found really is that the community is always ready to help. We at Common Ground formed a speakers bureau. We have over 70 people who have volunteered to be part of that speakers bureau. And we have many, many organizations, over 50, have taken advantage of that service to have people come and talk about COVID and talk about vaccination. So now it feels like we're on the road. We're getting on that road again. We're on the road to recovery. And it's really all about all the people that we've been able to touch. We've impacted thousands of people through collaborating with our partners. And that's what's going to bring us back to health. We've found that collaboration is key, and we strongly recommend it for any community response to keep us on the road to recovery. Thank you so much.